Sure, welcome. Today we're going to be in our in the second part of this year. We're going to focus more on uh, stuff of interest of second year students. And tonight we're going to be talking about things like boards, academics, etc., the important things. So, I'm going to make a point of introducing myself. I'd like some of the other folks on here to introduce themselves. I'm Mark Baldwin. I'm the chair of primary care here at the Arkansas College of Osteopathic Medicine. So,
Oh, well, I can introduce myself. I'm Angela Cavanna. I am the course director for clinical systems at the Terrell College of Osteopathic Medicine in Middletown, New York. I have a unique um, I'm boarded in both internal medicine and sports medicine, so I have a unique background. Let's put it that way.
thank you. Dr. Lightfoot.
Hi, I'm Judith Lightfoot. I'm the chair of the Department of Medicine at Rowan Virtuous School of Osteopathic Medicine. I'm boarded in internal medicine and infectious diseases. Welcome, everyone.
Thank you. By the way, I'm boarded in internal medicine and nephrology. Uh, Dr. Carilla.
Well, thank you. I'm Dr. Carol Carilla, and I'm I'm an associate professor of internal medicine at the Kansas City University on the Kansas City campus. And I'm boarding in internal medicine and very grateful. But as Dr. Baldwin knows, I've done a lot with nephrology as well.
Junior nephrologist.
Thank you.
Dr. Good.
I'm just an observer.
You can't get off that easy.
Yeah.
Robert, you're not going to be, you don't just observe. Come on, that's not you.
I'm Robert Good. I'm a professor of medicine at the University of Illinois in Champaign.
Good. And Dr. Tolentino.
Hi, everyone. I'm sort of just an observer as well. I'm David Tolentino. I'm Associate Dean for Clinical Affairs and Associate Professor of Internal Medicine at Campbell University School of Osteopathic Medicine, board certified in internal medicine, and also a board member of the ACOI and on the Osteopathic Medical Education Committee. So it's good to see everybody. Glad to be here and here if you need me, Dr. Baldwin. It's good to see everybody.
Okay, good to see you. Thank you.
Yes, sir.
Dr. Rosh, I saw her floating around here someplace.
Okay, guys, I'm eating dinner, so that's why my camera's off.
That's
so good
okay.
to see everyone. I'm Laura Rosh. I'm board certified in internal medicine. I have the good fortune of working for Rocky Vista University as a campus dean in Ivins, Utah. And great to see everyone.
Thank you. Student Dr. Ranta, last but not least.
Hi, everyone. I'm Emily Rance. I'm a fourth year medical student at VCOM Carolinas. I am not boarded in anything, but that's okay. That's to come. And I'm a fourth year, so I'll match soon and then graduate soon. Very excited to be on here and talk to you all.
Thank you. Jeremy McFarland, thank you for you and Kara for putting this together. Tim McNichols, again, thank you for all the things you and ACOI do. So, how do we get ready as you're getting ready to go into your third year? How do you prepare to be a superstar? And we're going to be talking about some things like boards and academics and that, so that really help you with your toolbox going forward. I've been asked to speak about academics. Of course, that's first and foremost for everyone. At the end of the day, you have to be able to do the academic work. I think that, again, for many of you that have not had medical experience, the stuff you've been learning for the last couple of years or for the last year is just one and two dimensional facts. And coming this summer, you're going to be able to put this in a three-dimensional context of, wow, that's what a diabetic foot ulcer looks like, or wow, that's what a systolic ejection murmur sounds like, or wow, those are what bibasal arousals sound like. I can tell you I've been doing this for a while, and I still get dazzled when I hear or find a cool physical finding. There's, although I'm not going to talk about boards, I do want to touch on something. You know, your curriculum at the end of the day is your best board prep. I know there's a lot of you have a lot of it, but that is really the best. And coming up with a way to kind of look through that before you do your practice questions is really important. Academically, a lot of schools are on pass fail. Some schools, like my current school I'm at, we still have grades. So things like grade point averages and class rank in those institutions are something people will look at. So again, do your best. I know I can speak for myself. I was not the most stellar student my first 2 years, but I really excelled on the clinical side. And as a result, at the end of the day, residencies are looking for people who can do the work and can work within their system. So with that, I will pass this on. I think, Dr. Cavanagh, were you next on the list?
I think I may have been, right, Jeremy, if I'm not mistaken?
Yeah, we just said alphabetical.
Yeah, Jeremy,
Okay.
help us out with the order here, please.
Sure, no worries. Well, I'm just going to reiterate what Dr. Baldwin mentioned. I think that, we always tell our medical students that your board prep starts on the first day of your classes. So your curriculum in most of your medical schools will help support your board studying right from the get-go. I also feel that it's important that you start doing those practice questions early to kind of keep keep yourself on point and kind of bring back to the forefront what you have already learned, and just keep it fresh in your mind. I was going to talk to you about you know Dr. Baldwin mentioned that some of you may not have some clinical experience, but one of the things that you're going to be asked to do and submit to faculty members, and also as part of your residency application, is your curriculum vitae, right? Your CV, your resume, okay? And we're going to have a full webinar associated with on how to write your CV. So I'm just going to mention a few things because, as Aaliyah, who I was just talking to earlier, can tell you, is that we ask our students to submit their CV to their faculty who are providing comments for that medical student performance evaluation, or that MSP, that composite dean's letter that a lot of schools put together. And it's a good thing that I know a lot of the students really well, because if I was to go based on their CV, I'm like, who is this person? Okay, they went to this college. Here's their name, here's their address, here's their contact information, here's their, what college they went to, here's if they've had any employment experience, great. If not, it's very, there's a paucity of information. I think the important things, and if as a program director, and there was several on this call, you want to get to know that candidate very well. So, what have they done? Are they affiliated with any groups like ACOI? Are they affiliated with student groups? Have they held leadership positions in any of the student groups? What do they do outside of school? Are you, do you have hobbies? Do you have interests that are outside of school? Because I think sometimes you'll connect with program directors or, other individuals looking at your CV based on common interest and likes. We have an anatomy professor here who's a huge rock climber and loves to talk about rock climbing, right, Aaliyah? And so, these are things that, we're looking at a 360 view of the candidates that are applying for residency programs. So You don't want to be, you don't want to have a resume that's 20 pages long, but you want to point out highlights. I've also had students that had, lots of volunteer experience and were active, involved in the community and doing a lot of great things, and it wasn't on their CV at all. So again, don't put everything in there, but at the same token, you want to give people a good 360 view of who you are as a person. And I'll stop at that point and turn it over.
Thank you, Dr. Cavanagh. Really good comments. Jeremy, and who's our next batter here?
Yes, Dr. Lightfoot is here with us to share.
Let's see, Dr. Lightfoot, would that be you?
Yes, okay,
My apology. Thank you.
okay. So it's Jeremy asked me to talk about a program director, what program directors are looking for. And Dr. Cavanagh kind of touched base already on some of that introductory work. And I interview a lot of students as a program director, and I have been in the past for many years here at Rowan. But I also end up writing, my role has changed. I end up writing the letters of recommendations now for students for other programs. But I also try to get students prepared for what an interview process looks like. And I think that is essential as many of our students go out and they go to different programs to interview, and I want them to be best prepared. Having their CV written well to represent them, to give an overall evaluation as to just the eyes on a piece of paper, to get familiar with them as to what they have done, where they're from, their likes, dislikes. Any kind of poster presentations, clinical research that they may have done in their first or second year is also helpful. As you all know, the ACOI has a program student presentation, poster presentations. Even if you presented in any of those presentations throughout your first and second year, or if you attended any major meetings, we want to know about that. Your volunteer work is essential and what you have done in the community. But also, what I want to know is, what do you want to do? Why internal medicine for you? Why is that important? I don't really appreciate a personal statements about fluff. I want to know, why do you want medicine, and why does medicine need you? I don't want to hear that your story, I was going to Mars and one day I was walking down the street and then all of a sudden, the rock fell out the tree and then it hit me. And not that, just really concrete, basic, why do I love internal medicine? But I'm also going to ask you about, and I think it's important for you to know, what are the textbooks that involve internal medicine? What do we go by as general internists to refer to, and not just the websites or up to date for the experienced clinician that they use? But what are your resources and where do you go? And you need to know the names of Harrison's for one resource, but there are others, many others. But I want you to feel relaxed, and I want you to know how well do you work with others in a residency program, because that's important. As a program director, I want to see that you can engage with others, that you can work in groups, and that you're committed to the life of a general internist. Many of you are going to train in hospital settings and outpatient settings and general internal medicine, because it's a primary care subspecialty as well. You'll have the experience of both. And if you take each clinical rotation as you ascend on your third year to try to be the best and challenge yourselves to learn everything about that rotation, on that rotation, you're going to do well. You'll still be able to study your board questions. You practice those boards, do some questions, 10, 15 questions every night, but you should also be reading articles that go along with what you've learned that day. Just one. A good article, so that you can support your basis for learning. And it's not for you to impress me with that in the interview, it's for your educational learning, because we never stop learning. Many of us who are on this call, read or try to read something every day. Or what I say, when it's quiet, when I can be isolated, and which I can read. Even when we're away on vacation, we still read. And some people say, when do you separate? Well, if you love what you do, you never stop reading. This never becomes boring. Medicine is about discovery and knowledge, and you have to be excited about what you're entering. Medicine has to move you, and you must be the future and change of medicine. So as a program director, I'm looking at, are you ready to join and be a part of a system? Are you motivated? You should be able to tell me about my program and my institution before you sit down in that interview chair. So do your homework on the program in which you have the privilege to be interviewed for. Know what expectations in which we're looking at, and not everyone gets an opportunity to rotate at the site in which they're interviewing for, but you can do your research. They have websites. They also, some residency programs have programs or internet chats with residents, first, second, and third year residents or chief residents may hold sessions. You should try to get involved with that or be able to attend those sessions prior to going to that interview session. But first and foremost, do not name a subspecialty when you're applying for a general internal medicine residency program. You're trying to be a general internist. If for some reason you want to develop into a subspecialist, that will come in time, but you must know the general principles and practice of general internal medicine. Or I say, be the specialist of all the entities and disciplines of general internal medicine, and know why you're an adult doctor. What separates you from primary care, from a family practice, versus general internal medicine? When people tell me I'm going to be a cardiologist, I'm like, okay, well, what about allergy, immunology? What about oncology? What about the hematologist? Can you read a CBC? Can you tell me everything about that? Why is that important to you? That does pertain to the heart. So even though that's where you're trying to get to, you want to make sure that in that residency program, you're becoming the master of all the entities of the disciplines of a general internist. Why do patients want to come to you? So the subspecialty area will come if that subspecialty bug bites you. I'm not saying don't lose hope for fellowship, but you want to be able to make your mark in every area of general internal medicine. The other thing that I like to look at, everyone in their first year in a residency program will ask me, well, what research can I get into my first year? You have to learn your bases, get oriented to the hospital, the responsibility load that comes with rounding in a hospital versus an outpatient track. Don't worry about the research the first year. Don't worry about being on executive committees in your first year. That will come in your second and third year. First year, we want to get you settled, that you know what you're doing. Although there are people to help guide you, like I said, help guide you. You are not a student at that point. You're a full-fledged physician who is in a training program. But when you are presenting to another resident and attending upper level resident, you want to have your assessment and plan together. And you're going to learn how to develop that. You've learned some in your second year clinical years, but you're going to develop that further in your third and fourth year. And certainly by the time you're in your PGY1 year, and you want to build on that. Every phase of which we move and ascend in medicine is a building. So I want to hear that when it comes along in the residency interview process. Most programs, they're all great. You can really do well in any internal medicine program, but you want to know that that program wants to choose you, and you want to be able to come across in that interview process as a very caring individual, a very dedicated individual. Don't just say, what are you going to do for me? No, we're selecting you to be a part of us. You're going to learn, but you're going to have to put a lot into it. And most of all, know the program, train well, be dedicated, be motivated, and know that you're working with others, other healthcare professionals A lot of programs have multidisciplinary programs where you're working with other allied health professionals and other clinical team approaches to medicine. Things are changing. You'll see that in the hospital environment. Please don't insult anyone. Be very humble about your position, but also learn as much as you can and be dedicated to the program and be prepared to ask questions. I ask questions and I expected potential students who are coming to our programs to be able to answer those questions. I didn't consider, and I asked about life situations. What would you do? And I asked about if you had a patient and they were in a complex situation, how would you handle it? I would ask it at the appropriate level. I just wanted to see how you would think if you could pull it together. Don't be afraid of that. It is an interview process. Take it very, very seriously. Practice in the mirror if you have to. Most of them are done by WebEx now. Most students are not flying cross country in person. Some programs may require them in person, but some of us are doing them by WebEx or by Zoom. I don't know if some of the former program directors or program directors on this call, if you're doing them all in person, but most of ours have been done, some in person, but most are being done by WebEx just because it saved a lot on travel expenses. And be prepared when you come into a system that you are there to learn, but you're also there to carry out the duties and on the responsibilities of a hospital system. And people are counting on you, and this is something you can handle. So I'm excited. I remember graduation day still like yesterday, although I won't say how many years ago it was, many, many years ago. I'm still excited when I think about what we had traditional internship years back in the days. I'm still excited about my residency and my fellowship. And I can memorize the layout still today of each hospital system I was in. And I don't remember the patients' names as well, but I can remember diagnoses were always associated with rooms for me and places and times. You're going to learn that. So I want you to be excited about what you're doing and why you're going to that interview. And actually, before you start your interview process, I'm sure some of your schools are going to have mock interview sessions. If you don't have that, it's one thing. What we do, we bring general internists in, and we also bring subspecialists in for the internal medicine clubs. And we actually have mock sessions like in the evenings so that our fourth year students can get used to a panel of people questioning them and firing off questions one at a time. So that may be helpful if some programs don't do that or some schools don't do that. We found it to be very helpful because we want you to be prepared. So I'll take questions when questions are open, but that's what I have to say. As a former program director, someone who writes letters for you. And by the way, for every one that I've had the privilege of writing a letter from, you have an interview with me in person. I never write a letter for someone I do not know. I remember at one approach, the university tried to get me to just write a standard letter because we're up to 264 or 78. I stopped counting. I said, listen, number one, meet your deadlines. Chairs, other professors, they all have other schedules than what the student thinks we're on their timelines. We have a lot to do. So if we say our deadline is September 1st for the letter, make sure your request is in and all your information is before them. And if their scheduling person says you have to have an interview, make sure you keep your interview with them because that's so that they can write a well-rounded letter for you. Okay? And be respectful to our staff. Thank you.
Thank you, Dr. Lightfoot. You brought up a point that I think is really important, and that as you're heading out to your clinical years, be open to the experiences. You may come in and say, wow, I really want to do internal medicine. And you may get, OB may be the thing that really grabs you. Be open to those experiences. I just can't emphasize that enough. So thank you. All right, student Dr. Anta, if you could give us a student perspective.
Certainly. First of all, wonderful comments by all three. I think I also want to reiterate what Dr. Baldwin says and kind of just make sure that it's pretty clear that academics are very, very important. I actually just completed a research project about looking at, evaluations during the third year and looking at how residency places get not interviews, and board scores and academics are up there. They are always up there. And so, my first thing is, definitely do not sacrifice academics for anything. And what I mean by that is obviously if some personal life circumstance, that's not what I'm talking about. I'm talking about, hey, you want to volunteer more? That's wonderful. It's great. But don't let it affect your board scores. Don't let it affect your grades. Those are very, very important things because they really do show both your commitment to the learning opportunities, but they also show your commitment to putting in that hard work. And so, I think it's very important to keep that in mind as you go throughout trying to build that CV up and trying to build what program directors are looking for. So academics, how do you do that? The best way to do that is really going to be individualized by every single person. There's no one way that works for everyone. And I think that's the kind of beautiful thing about it. You have to be very open-minded. If you're doing this study way and study method and it's not working for you, change it up. Don't be afraid to try new ways. Don't be afraid to say, hey, taking 15 questions a day isn't working for me. Maybe I should try to do bigger sets on Saturday. Or, hey, me watching these videos isn't teaching me a whole lot. Well, then maybe you should get a tutor or work with someone or something like that. Don't be afraid to think, even in, you're 6 months out from boards, don't be afraid to say, this isn't working. I've got to go back to square one and figure out what I can do to do well on those boards. That is very, very important. And I think it's just really important to keep that framework in mind as you think about how to build that CV and beyond. Now, when thinking about CV and building that up, I would always, err on the side of don't just do more. Doing more does not mean anything. If you do 100 different things, but you can only write a sentence about 100 different things, that's not going to be good. That will be very clear. It'll be very obvious that you don't do anything. With that said, it's not a bad idea to, in the beginning, start, getting involved in a ton of different things. Don't, throw out a net, see what you do. Get involved in maybe 20 different things or so, and then focus in on what you really are passionate about. Let's say you sign up for, 10 clubs or something. That's already a lot, by the way. That's kind of crazy to even think about. But let's say you do 10 different things. And then you find of those 10 things, your 2 or 3 things you're really passionate about. Stick with those 2 or 3 things. Don't do 10 just for the sake of having 10 things on your CV. It's not going to be worth it. And it's not going to, reflect well when you interview with someone. Because if they ask you about that and you can't provide specific details on what you've done, it's going to be pretty clear. And you start thinking about not just volunteering activities or leadership opportunities, but research. Don't just do research for the sake of checking a box. I think it's very important to try to find what you're passionate about. And sometimes research is really difficult. I know I struggled with research and finding opportunities with research, but don't be afraid to go up to some of your mentors and just say, hey, are you working on any research? Or are there any students that you're friends with that are they working on any research? Or do they know of any mentors that are working on any research? And, if you see a cool case on your clinical rotations, well, do the research. Go read articles. Is it out there? Is it available? Has that already been discussed? One, that expands your knowledge on the subject, but 2, it shows you if there's a gap in the knowledge in the subject overall. So I think it's really important to think about, multiple different sectors, but I would always go back to that one thing: academics, 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 and then find what you're passionate about and be diligent with that. Don't do 100 different things. That's just not good. And then I think the last thing I would say about balancing, because that was really what I was, supposed to talk about from the student perspective of balancing. Medical school is very stressful. There's many different stress for different people for different reasons. We all are stressed by something. Maybe clinical rotations are more stressful for you. Maybe the material is more stressful for you. I would say find an outlet. Remember that first and foremost, you're a person, and, forgetting that aspect of your personal life is not going to be good. And honestly, most of my interviews, hobbies were brought up so many times because they want to know that I'm a person and that I can do more than, learning medicine is obviously the first and foremost. I'm coming to residency to be a good internist. That is the absolute goal. I want to be a great internist. But in order to be a great internist, you have to give your own support to yourself. You have to, be mentally stable. You have to be physically stable. And a lot of times that means you have to do things beyond medicine. What a wild concept for a lot of people. But, if that means you like to run 5Ks, great. if that means you like to ride bikes or go on walks or do something like that. It's really important to make sure you put that value inside yourself so that way you're not left empty and constantly going to the hospital. That affects your learning, that affects your attitude. It's very, very important to keep that in mind, to fill your cup before you go into any rotation. And the last thing I'll say is, having been on the interview train for the last couple months now, I think it's just really important to just be very true to yourself. Do not try to, sway into something different than you are. Find what you like, find what you're passionate about, and really dive deep into that. I think that a lot of times we try to find a cookie cutter mold and try to fit to that. And I think that's just not the right approach. You want to make sure that you're individualized, you're unique with the same goal of being, hey, why am I going to medicine? Why do I want to be an internist? And, if you can find that and that resonates with you, great. If you find that it doesn't resonate with internal medicine, that's okay, but like make sure you do some like real self-reflection to find that what is that for you. And I think that's really important. Like when I had to prep for interviews, I was always asking myself for every interview, why am I doing medicine? Why am I doing medicine? Why am I doing medicine? And like for me, I'm confident. I'm absolutely confident that's what I want to do medicine. But just make sure before you go to that's, for sure what you want to do because residency is hard. Doesn't matter if you're going to internal medicine, doesn't matter if you're going to OBGYN, doesn't matter if you're going to family, it's all hard. And so you want to make sure that, internal medicine is something you're passionate about and something that like if you will notice through, both your academics, but also your rotation and how you're like involved in everything, if that's something you want to pursue. And if it is, dive deep into it and really like don't be afraid to just go learn. And I hate to say it, but be a nerd a little bit. Some of the best internists that I've seen are kind of nerdy, and that's okay. Like read the articles, be up to date on things, not like up to date the website, but like up to date on things, know the newest guidelines, know these things. I think it's really important because it shows that you're really invested. And I think it makes, the career and the field in general more fulfilling. So that's pretty much all I have to say. I'm also happy to take questions whenever we do the questions.
Okay, thank you very much. Again, I'd like to thank student Dr. Ramta for your wise input, Dr. Kavana and Dr. Lightfoot, great comments. So we're going to open it up. If folks have questions, please speak up. We'll be happy to try to answer them. So. Or if you want to type something in the chat, Jeremy, if you could read it too. Thank you.
I have a question for some of the program directors and former program directors that are on the line. We always ask this question, and we're always asked this question: should I take USMLE Step 1, Step 2? So I would love to get opinions from those that have been in that position from a program director's perspective.
From my perspective, it's not necessary that they do. Our boards are fine, and we take our boards. They're equivalent to USMLE Step 1 and Step 2. We have students who've done both, and I've noticed more and more it's increasing, but it's not necessary. And we've had students who've gotten into some very top places with just taking our boards without USMLE.
I am not a program director, but I did not take USMLE Step 1 or Step 2. And I personally did not feel that it hindered my ability to get interviews. But I will put a caveat on that if you do plan on taking USMLE Step 1 or 2, don't let it affect your COMLEX scores because you have to pass COMLEX to graduate.
Yes.
So if you're preparing for Step 1 or 2 and you are failing your COMSAs, drop it. It's not worth it. You have to pass those. So that would be the one thing I would say is if you want to take them, great. It might help you. It might not, but don't let it affect the COMLEX scores.
Jeremy, there was a question in the chat. Let me.
I have a question from I guess I don't want to assume you're a student doctor, but I'm assuming you're a student doctor, Shreya. Hi, I am interested in pursuing research as a first-year medical student. There it is. How do you suggest I start this and find ways to get involved?
Shreya, as Emily so kindly said earlier, is find something that you're passionate in. I think that's the biggest thing. Also, check with your mentees at your school and see if there's any projects that you might be interested in. I know we we personally tend to tell our first year students not to get involved until their summer between their first and second year, or into their second year at some time, or even into their clinical years, because they have a little bit more time in their schedule to really pursue that. But I think research comes in many forms. I
Mhm.
think the um, attention to your grades in your first and second year are very important.
Mhm.
And don't let the research try to distract you from that, because it in some people it has, and I've had a couple of students that almost failed classes because they were waiting to get their research published, and it was problematic for them when they went and had to explain in their interview process why their GPA dropped all of a sudden. But I would check with your advisors at school, mentees, and things like that.
Yeah, at the end of the day, you have to be able to pass your courses. That's why
Mhm.
you're there.
So
Dr.
at
Light?
Rowan, we have the DO PhD program. That's a whole separate track. But we also, all students who want to do clinical research have to be approved first through our translational research program, and they have to be aligned with a mentor who is doing research. But they have to be in good academic standing. That's everyone across, and who they're working with also has to be. We're finding that students were going off trying to do research on their own, getting into journals, some not really credible at all. And no one was checking what they were doing, and that had to stop. So be careful, please.
I would say most schools also have some sort of research advisor or
Yeah.
research
Hmm.
counselor.
Yeah.
I know our school certainly does. It's not a bad idea to, if you want to get involved in research, first learn how research works. And so
Yes.
there, a lot of times they can provide resources on what is a case report? What does that really entail? What is original research? What does that really entail? I think a first year medical student, I would definitely agree, focus on the learning. If you want to, increase your learning or increase your knowledge, you can learn how research works. But I would just pause on doing any research, at least until you get comfortable and get that first year under your belt. And then maybe you can consider doing some. But it's also very important to learn how research works too, because otherwise you're going to be, submitting to journals, not really knowing what you're doing, not really know what you're submitting.
Yeah, don't say over the summer, I want to find a cure for cancer. Yeah, you got to be realistic. So, yeah. Okay, our next question from student Dr. Greerwall. What does good academics mean for IM programs? Thank you very much for hosting this. Dr. Lightfoot, you want to lead off on that?
Good academics, you're in good academic standing. You've passed your courses, particularly if you're in pass fail. See, even though we have pass fail program and we have the letter grade program, your pass fail still has a ranking. You just don't see the ranking of the pass fail. So strive to do well in each of your classes, even if they are pass fail, and make sure you're in good academic standing. You get your exam back. You know how you've done. So if it's a pass fail course, if it's a letter grade, it's the obvious. Um, I understand with the pass fail curriculum, because we do both, for a lot of the residency programs, students feel as though they must do research in order to get into some of the higher specialties. And if they don't have research on their CV, then they're not going to get into a certain type of fellowship or a high-end specialty. That's not necessarily true. You have to be a solid student, number one. So your time in which you study, how you prepare, how you're coming across in your exams, if you're having to remediate or whether you have to come before the academic board, it's no shame in having a tutor for any course. The bottom line is that you've passed the course. There's no shame in having to give up extracurricular activities, because your focus in being accepted into any school is to pass your classes.
Yeah. I think also, when we think of good academics, it's not limited to your first 2 years.
Right.
It is being a good student on your rotations, reading up on your patients, reading up on the diseases, being prepared, those kind of things. I mean, that's again, your preceptor's evaluation of you, I can't stress how important that is. When I write letters of recommendation for residency programs, I like to see my students evaluations on rotation, see what the preceptors thought. I may have worked with them for the first 2 years, but I want to see how the knowledge we gave them, how they put that into work. So, yeah.
And if I can add to that, there's one thing when I'm rounding in a hospital, when students, it takes you no time the weekend before you start a new clinical rotation to review that clinical material from your second year. To walk into a rotation, to just glance over your notes, that course, it doesn't take a long time. You should be prepared and to review, just review before.
I definitely would emphasize the evaluations in third year as well. That's also one of the top 5 or so things that residents look at or residencies look at before offering an interview. And I think it's important to remember that it's not just your internal medicine clerkship that they're looking at. They're looking at all of them. And so it's really tough, I think, in third year. I think that's always going to be a tough year because you have a really high expectation, but you should also have that high expectation for yourself. Like come in early, stay late, be willing to come in more. And I know that's really tough sometimes, but all of those don't go unnoticed. And that will reflect in your evaluations where they'll have comments. And I think it's really important, like if you have a negative comment, that's okay. It's not going to be the end of the world, but just try to see what you can learn from that. How can you grow from that? See if you can get feedback on that negative comment. See if you can do better in that next rotation. Because a negative comment in, your first clerkship is okay, it's your first clerkship, but a negative comment at the end of the year because you didn't ask about you didn't ask how to get better at that. I think that shows that maybe you aren't willing to, seek feedback and seek guidance. So that's just something that Dr. Lightfoot, do you have anything else to add to that?
It's constructive critique. Listen, you all aren't experts. You're learning. You're in your learning phase, and don't be afraid of you're being challenged. We want to make you the best, and so you're gonna hear comments, but they're only meant to help you.
Yeah, and the only thing I would add to that too is when looking at academic status too, I think that as someone reviewing even potential candidates for medical school, I don't want to see, A's, B's, and then all of a sudden D's and C's, and then A's and B's. So what is going on here? How come I'd rather see a straight across B student or a straight across, even someone who's just passing? They might be struggling, but at least they're doing, they're consistent in their studies. Because I've asked students that before, how come, you did poorer on this exam than another one? And it's like, well, quite frankly, I didn't take the time to study as well as I should have, like if they even retook their MCATs or something like that. And I think that just shows a lack of, commitment to studying and to bettering yourself. So I think that's something too that also should be looked at. And definitely those comments are very important because it shows who you are and how you're working with your peers. So
Thank you. Student Dr. Kayla Perry, you've had your hand up for a long time. It's probably getting tired. So what's your question?
Hi, thank you all for hosting this panel tonight. My one question that I had was, as a residency director, do you value preclinical or clinical grades more, or the same?
I look at it all. I look at all of it, but I look at the progress in which you're making because that you're making throughout your transition of years of training. Preclinical is just what is your background that you're going to build. Everything is a building block. It's all building. And for those students who aren't strong academically on a board, I still have your clinical assessment of what those preceptors have evaluated how you were on time, the data information, how you presented on rounds, your ability to say, to raise questions, to be able to teach others, to work with the team, and you're putting in the effort. How you come at the feedback that the patients are giving me about you being attentive to them, or you're participating in the clinical discussions. Or when you have my students, I'm sure students everywhere or residents everywhere are still presenting on rounds or have presentations to do at the end of their clinical rotations on a topic. How well you prepare for that? And to get it to present before the department. I think we're still doing that in most places, at least we are. I think that's important because you're going to turn around and you're going to do that as you teach and you move forward. So I'm looking, it's all a building block. All a building block.
Yeah. Yeah.
Biochemistry is very important, as Dr. Baldwin will tell you, that Krebs cycle and that nephron. Acid base. Don't forget your acid base. Huh?
You made my day, Dr. Lightfoot.
Yeah, don't forget acid base. It was painful to learn. Phosphofructokinase, at PCOM. My biochemistry teacher, Dr. Yin beat me so bad with that. But seeing her later, I thank her for every bit of it.
Yeah.
Have respect for the nephron, she used to say. But go ahead. Sorry.
Okay. Dr. Perry, I hope we helped you with your answer. I have another question. Go ahead. I'm sorry, Dr. Cavanagh.
Oh, no, I'm good. I was going
Okay.
to answer Minna there in the chat.
Okay, please do. Yeah.
So in order to answer your question, I think what you need to
Can you
do
repeat the
is.
question,
Oh,
please,
I
Dr.
certainly
Cavanagh?
can. It says, as a first-year medical student who left his state of residence for medical school, what are some things that I can do to make it back to my state when it comes to applying for residencies there? So I think the first thing is do your homework. Look at the residency programs, look at the places that you want, that you think would be worthwhile for you or things that you're interested in, and then. And as Dr. Lightfoot mentioned earlier, see if you can do part of, either a third-year elective or, a sub internship in your fourth year clinical to get into those places. And then, everything that we've talked about so far is going to help with that residency application. But I also think networking, okay, who are the physicians in those programs? Are there any state societies that you could join as a student where you might come into contact with physicians that work at those hospitals in those programs? Talk to other students who have gone through those programs. Look at the residents. Who do they take as residents? Have there been anybody from your school that's been there? Talk to them about the programs. I think these are all things that the more you find out about the program, the more likely the more likely you'll match at those programs. But you have to do the homework. You have to figure out, why you want to go there, and what interests you about that program.
If I could just add something in general, I am from the Midwest. I trained in the Midwest. I've been on the East Coast. For the last 10 years before I came to Arkansas, I was in Washington State. And I was really kind of surprised, kind of west of the Rockies, that not as DO friendly as I had experienced previously. Kind of a rule of thumb, take a look at a roster of the program. Look at the residents, look at the attendings. If they don't have any DOs as residents or attendings, or maybe have one, you may not be the guy who breaks the ceiling. And I'm saying that in realistic terms, because not every place is enlightened as what Dr. Cavanagh, Dr. Lightfoot, and I are used to seeing. So just also keep that in mind too. So.
There are also a couple things on the ERAS application that you can use to your benefit. They don't necessarily guarantee you anything at all, but there are signals on your application where you can signal programs. There is a two-tiered system. There are gold and silver signals. Use those to your advantage. Sometimes they get your foot in the door. Sometimes they do more. I really don't know. I'm not obviously not a program director, but I know that signals can be looked at in a valuable way sometimes. So that's one way you can think about if you're trying to get back to a specific area and you like some of the programs, you've done your research, you can signal those programs. And then also there's geographical location located somewhere in the application as well. And you can mention, hey, I'm from this area. I grew up in this area. Mention that. I think that's really important. I've had people ask me in my interviews, hey, so why? I mean, I saw that you're from this area. Do you have a lot of family here? I'm like, oh yeah, I have a ton of family in this area. And they like to hear that because it means you have a support system in that area. And that's going to be helpful for your development as a resident. So there's a couple like technical things that can help you in that way as well.
Good information. And we have Oscar Juvera, who has recently been accepted to ARCOM. Congratulations. And he said, I might be getting ahead of myself by assisting meeting like this. You're more than welcome to come here, and we're more than happy to have you. We want to ask, what steps can medical students take early to make themselves strong candidates for residency programs? Your first year, your first 2 years, academics. Okay. Coming into medical school, no matter how good of a student you've been in undergrad or even graduate, medical school is a whole different ballgame. And it's absolutely essential that you have to learn how to organize large quantities of information and prioritize what's most important, what's least important, because that's going to prepare you when you go on your clinical years. You're going to be overwhelmed with a whole bunch of clinical details. You have to organize it and prioritize it with, at the top, what's going to kill this patient in the next 5 minutes, down to the patient's going to die of something totally unrelated to this. So that's my opinion. Panel?
No, I agree.
Agree.
I agree. Yeah.
Agree.
Yeah. Okay, another first-year medical student. Wonder what specifically would you recommend beginning to prepare for step one? And what do these prep goals look like? Do you set a certain amount of questions at night or amount of topics to review a night? What did balancing that with your second year material look like to you? Now, when I took boards, they were on papyrus scrolls. So, Student Dr. Ranta, let's start with you.
Yeah,
I saw those booklets. Remember those, more?
Oh yeah.
well, they're all on the computer now, so it's a fun day. Your eyes are strained by the end of the day, but no, that's okay. It's just it's preparing for clinical, you're always looking at a computer. So I'm assuming when you say step one, do you also mean COMLEX or do you mean USMLE?
Yeah.
Because that is a different preparation. So I would say that if you are preparing, and the reason I say that is because, okay, I just want to make sure. Because if you're preparing for both, you do study slightly differently. So our school has TrueLearn. I know other schools have other things as well. But I kind of said it a little bit earlier. I think you have to figure out what works best for you. Now, me personally, I found that I would do some questions here or there. Typically during your second year is when you want to start ramping up that question amounts. And then sometime around January is when I started really ramping up that amount. And I think it's important to give yourself that endurance practice. And so what I mean by that is a lot of times I would take sets of 4 sets of 40 or 4 sets of 44 or something like that. And I would do that at least once a month. And the reason behind that is because you may know the information, but if you're not mentally prepared to sit there for 4 hours and look at this information, you may not do so well. It's kind of like how you would probably prepared for the MCAT. It's important to review information, but it's also really important to build up that endurance for exams. And I would also say a lot of people don't do this, but having that 4 sets of 40 or 4 sets of 44, whatever you want to do, it's also important to take one in the afternoon because I think that a lot of people overlook the afternoon sections. They're like, oh, I've done the morning. I've prepared for the 4 sets of, whatever in the morning, but then you get in the afternoon and you crash. But I think it's really important to test out what foods keep you awake, test out how much caffeine you need. There's like a science behind all this. And I hate to say that because it's like, well, what about all these things I have to learn? But it's just as important to figure out how to be an efficient test taker. And then when it comes to like reviewing those questions, you should spend more time, in my personal opinion, reviewing questions than taking them. So if you take a question set of 20 and you take them in, I don't know, 25 minutes, it should take you about 40 minutes to review those. And if, you got them all right, okay, maybe it doesn't take you that long. But if you didn't get them all right, then it should take you some time to review those, because a lot of times what you're missing is both material, but you're also missing, question strategy. And so that's really important. Now, moving on to balancing second year material, that's going to be the tough part. So clinical rotations they're very different in terms of hours. Some rotations, I would say, like surgery, may be more hour intensive. Some rotations are maybe less hour intensive. And I think just kind of having that balance and knowing that you're not going to always be perfect is really important. So give yourself a little bit of grace. Maybe you can't hit that 10 questions because you're working 14-hour shifts for the whole week in a surgery rotation. That's tough. But when you have those rotations, maybe where you're working a little bit less, try to make up for that a little bit. But the same strategy kind of exists for me in terms of when you're about 4 to 6 months out from boards, start ramping up those questions. When you're about 1 to 2 months out from boards, ramp them up even more. But really start trying to do those practice sessions and endurance sessions, because those are going to be really helpful for you.
Yeah, and I have one other pearl because Emily, I appreciate the fact that you talk about practice sessions where you're spending almost almost the entire day doing questions, because I think the fatigue factor is a big issue in test taking, because some of us can know everything, but you get tired and then your test taking skills go out the window. One thing I always tell students when they're in their dedicated board prep time is to take a full length exam type of thing where they make it up from their true learn and treat it as an exam day. You block out your browser, you give yourself your breaks, you prepare your meals ahead, you tell people, you put your cell phone away, you don't do it, there's no distractions. And let me tell you, it's brutal. But I tell them to do that at least once a week, and then this way and then take the next day off to rest and relax. The other thing I also suggest doing, especially for preparation, board prep on during clinical rotations. There are a lot of podcasts out there. Divine Intervention is one, and there's a few others that are specific. They'll have specific topics for board prep. They're short, they're sweet, they're like 7 to 8 minutes. And a lot of students have to commute back and forth to rotation sites. And I tell them to utilize that time to listen to the podcast. I know I commute to work, and I very often listen to podcasts on my way to work every day, just to keep myself fresh if I didn't have a chance to read, because I don't have any quiet time in the morning. Okay, so those are things that you can do.
Yeah. I think one thing is that, especially when you're a second year student and you're starting to prepare for your boards, or you're continuing to prepare for your boards, if it's an area that you haven't visited for a while, before you do the questions, go through and briefly review that material, so it's still kind of fresh in your mind. If it's something you haven't seen for months and you go and you start missing questions, that can become very frustrating. So take the time to review the material first. So, Dr. Lightfoot, I'm going to give the last word to you if you have any wisdom. We're coming up almost at 8 o'clock. So
about the board prep.
Anything.
Well, it was interesting as I was talking to students how they prepare the PBL. We have both curriculums, that's this SGL and the PBL. The PBL students start studying on day 1, and versus the SGL students. But some of the students' methods, and I'm interviewing them because I want to know what is working well, because as a program director, I see the scores of everyone. And I must say, and it's not to define that SGL curriculum isn't the same, but we're really looking at this and trying to figure out why. But the PBL scores on both exams are higher than the SGL. And we're not sure why, because we know they do share some of the course material between both programs. So is it because of the small groups of 8 is one thought. They're working intensely. They're always with their group. So they're with them in the learning. They're with them with the studying from day one, versus SGL is a mixture. Some of them study independently or not. But I will say this, depending on what subject they're on, let's say clinical infectious disease, and let's just say UTI, just to keep it simple. Everything about the urinary system. They may start doing questions at the beginning of the week, 10 questions every night, but then on Saturday, they may do the whole urinary system as a board review. But just take 4 hours of their study time for the weekend just to do that review, and then go back to their regular study for all their other coursework. But they put themselves, someone does the master scheduling for 6 months and somebody does the other master scheduling. Then they come back themselves and do a mass review. I don't know if you all have that time to lay that. It's a pretty intense scheduling, but it seems to be working for some of them.
Yeah.
And then some people just want to study on their own, but no cell phones are allowed. They block everything out. They shut everything down. Everything gets shuts down. So I applaud them for that. But studying, as you've said, you listen to your, Dr. Cavanna listened to her podcast. We have boards too. We have recertification. It does not stop. So I too listen to my lectures as I'm driving in on my iPad or in my car or what have you, and do questions at 4 a.m. Listen to a lecture while I'm driving in. When I get downtown, when you're in a hospital, when you're leaning as you're attending, maybe writing notes or what have you, or they're talking to a family member, or you're wondering like, what's happening? Nothing's happening. You whip out that phone and you do some questions while you're standing there. So whatever opportunity you have, then you can get a couple questions in. That's what I have to say about boards and questions, because they're always going to be there. Always going to be there.
Thank you, Dr. Lightfoot. It's 8:01. I want to thank, first of all, the panel here, Dr. Lightfoot, Dr. Cavanna, student Dr. Ranta, Jeremy and Tim McNichols. Thank you guys for putting us together. Thank everyone for showing up. You had some great questions. Hopefully this was helpful. Dr. Cavanna?
No, I was just going to say, Megana, there's one question there directed to Emily. I don't know if you want to just answer that in the chat.
Okay. So thank you all very much.